Well, Labor has launched one of its biggest pre-election policies yesterday relating to the future of Medicare. But in a game of political ping-pong, the coalition matched it and then some with its own proposal. So much for fiscal discipline here. Joining us live is our Monday morning panel, Matt Thistlethwaite, the Assistant Immigration Minister, and the Liberal Senator Hollie Hughes. Good morning to you both. So, Matt, to you, bulk billing rates, it did need to be addressed, but the question of how to pay is a worthy one. So how are you going to do it?
Well, because we've been running budget surpluses, Pete, we've been saving more than we've been spending, and that's allowed us to respond to the needs of Australians who've been saying that they're sick and tired of paying to go and see the GP. $70, $80 for a consultation. It's meant that people have stopped going to see their GP when they need to, and they want bulk billing restored. And Labor's answering that by the large investment that we're making to ensure that 9 out of 10 Australians will have their visit to a GP bulk billed into the future. And that's a game changer for cost of living relief for Australians.
So the same question to you too, Hollie. I mean, without a suitable response yet, I don't think, from Peter Dutton, how do you pay for it? And were you pressured into the announcement yesterday?
Well, the announcement that was made yesterday also includes our $500 million commitment to boosting mental health services that were cut under this Labor government. We'll be looking to boost and return access under the Better Access to Mental Health Care plan, 20 visits to a psychologist that was slashed to 10 visits under this government. So we are pleased to see that the Labor government has finally heeded our calls when we have been looking to boosting workforce shortages. We know that we need to get more GPs into both metro, but in particular rural and regional areas. So after 2 years of calling for workplace reform and investment, we're pleased that the Labor government's finally taken notice of that.
Matt, as we just heard from the College of GPs, they said it's great, but it doesn't go far enough. I mean, obviously they would say that, but they also elaborated that a lot of doctors or GPs, they might not even go for it. They might not even bulk bill. So how much do you think this policy future-proofs Medicare?
We believe it will work because it's based on a similar incentive that we introduced for children and for pensioners and senior card holders. And when we introduced that bulk billing incentive, we saw the rates of bulk billing go up, and 9 out of 10 GPs adopted that principle and that approach for those in that group. So we believe that it will work. It's about ensuring that we're putting the universal back into universal healthcare, and that everyone that needs to see a GP can go and get access and have it bulk billed.
Do you think you've gone far enough, Hollie?
Well, we've actually gone further than the Labor government. As I said, we've invested more into mental health.
In terms of future-proofing Medicare, though, I mean, as the College of GPs said, like not all doctors will do it.
No, but history speaks for itself. When the coalition government left office, bulk billing was at 88%. It's dropped 11% under this government. So we're not going to stand in the way of Labor fixing its own created mess when it comes to Medicare. We want to see Australians accessing that primary health care because, of course, that will then take pressure off emergency rooms. And we know when it comes particularly to rural and regional Australians, getting access to a GP, let alone a bulk billing GP, is almost impossible in many areas.
Matt, back to you. The 2 polls out this morning, we've got a poll every Monday and you're on the receiving end of it, but 2 polls out this morning show a considerable gap between you and the coalition, but it includes the RBA rate cut from last week. So if that doesn't help you, how much strife are you in?
Cost of living's been the dominant issue, Pete. There's no doubt about that. And we're heading in the right direction. The rate cut next week.
But this shows you're not, according to the polls.
The rate cut last week will help. And I believe that yesterday's announcement on Medicare is a game changer. It will shift the dial because it means that we've responded to what Australians want in terms of their healthcare, and we're restoring Medicare. And we ended up in this mess because the coalition government cut the GP rebate. They froze it for 7 years. It meant that
after the Gillard government froze it.
Yeah, didn't that start under a previous government, Matt?
It did under the Gillard government. They conveniently forget that.
GPs couldn't afford it, so they started charging co-payments. So they exploded under the former coalition government. We're restoring Medicare. And I point to the fact that we introduced the incentive for children and for pensioners. Now, the coalition could have done that when they were in government. They didn't. We've done it,
But it
and
can't- but you can't
it's
deny.
resulted in those populations now being bulk billed. Now we're going to extend it to the rest of the country.
Just because you brought that up, though, I mean, you can't deny the fact that bulk billing rates declined under your watch.
Yeah, but that's because the former coalition government cut support for Medicare. Is it any wonder we've had a fall?
They went up
in
under
some
us.
of those services
they went up
because
6%
they were
under
cut
us. They
by
fallen by
the
11
former
under you.
coalition government, and we're restoring support for Medicare. You guys could have restored bulk billing.
You've been the government for nearly
for seniors
3 years.
and for children.
3
You didn't.
years.
You didn't. You had all the time
What
that
have you
you're in
been
government
doing?
to restore bulk billing for GP visits.
Okay.
You didn't.
Pete,
We're doing it, and now
this is just
and now
an
you're
example of
copying
why
our
Australians
policy.
should stop listening to these
let me
guys.
just jump in here.
You're copying it.
Let me just jump in because, folks, this is going to be the argument, the counter arguments for the next few weeks until this election called. So you made that point, Matt, to my question, but I mean, his question to you, Hollie, is going to be, and this will come from other members of Labor too, that could you have done something?
Well, they've been the government for the past 3 years.
But
what have they
before
been
then?
doing? Well, the GP rebate freeze was actually initiated under the Gillard government, and you notice that the Labor members never, ever mentioned that. But I noticed Matt did everything he could to deflect away from your question regarding today's poll results. So obviously the talking points are only covering their Medicare campaign that they plan to launch against Peter Dutton. I hope that Albanese keeps going as long as possible to the election, because we see that the poll numbers are consistently heading in one direction, because Australians just don't believe this government. They think Albanese is a weak leader, that he went to the election promising cheaper mortgages, cheaper groceries, cheaper cost of living, cheaper energy, $275 off your power bill, of which he's not only not delivered any of those things, they've seen them increase exponentially, which is why cost of living is the greatest issue for every Australian in the country at the moment.
All right, Matt, Hollie, we're out of time, but thank you for your time as always. We'll catch you again next week.